Good morning, everyone. Now, today we have another session on the Sunday session for the students, and it is related to our case taking process, analysis process of the symptoms. Uh, Now, the first thing that we have to do is to pick up the history, and when the patient used to, and usually they give and speaks in their own language. It may be the language variations and it may be the terminology they are very much acquainted they are using. But we are concerned with the language that is there in the Mathematica and in the repertory. So basic aspect for our uh, analytical process, but rather I can say that the first step to uh, get the symptoms into the language of the Mathematica and into the language of the repertory is essential. So translation work is very important, and the first step for the analysis that I feel is to translating the language of the patient. For this, today we are going to discuss about the translating the patient's language. How much we can be able to translate the language of the patient and how we can do it, and what are the. I'm just trying to give you some guidelines for it because translating is very big task, and it depends on your perceptions, what you can see, what you can observe, and what you have felt, and what you have experienced in your life. This is all these matters count in your during the process of interrogations, because many a time patients try to influence the person and physicians, and during this influence he uses the different language. He may be cajoling, he may be scolding, he may be doing something to it, and the purpose is only to attract the doctor's attention. So we have to understand what the patient is actually doing, and with these things we have to start. Now let us see what is the meaning, how we can translate all these facts into the reality of the, and our reality is lies within the Mathematica, because it is our limitations, because what we have understood about the things, and only that the symptoms that has been noted in the Mathematica and the repertory. So friends, that understanding from the patients and understanding into the Mathematica and into the repertory is a difficult task, an important task, and it is only a bridging is required. We have to make a bridge. That bridging is very much important. That how we are. So that means putting the, and it must have the same sense. Sense should not be deviated. Translation is simply not the word translation. It is a thematic translation which is required. So objective and the purpose is to perceive the patient language for the use at the rubrics lesson. This is the purpose for us. And now, what you say, each patient has got one language that sets his corridor for the life. And then there are the, we usually habituated to have the two languages. That's the spoken language that we colloquial language that we are using in the family, among the friends, and in the society. Then getting related with some unfamiliar persons, we used to have a different language. Like in our Indian culture and Bihar culture, we used to talk in our local language of the Bhojpuri, Mathili, Maghi, or in the Tamil, or in the Keralian. So many languages are there. Punjabi languages are there. So many languages are there. So this is the corridor of their life. They speak in the corridor of your area of their life. Now, with these corridors, doctor is trained. We are all are trained in the language which is available in the grammatical and bounded by the grammar and the paragraph and the patience and the teaching that we have received from our teachers. So this is one from one corridor to the another corridor. So it and then that for the Maghi or the our Bihari language, we are translating them into the Hindi language, the standard Hindi language or standard English language. This is the important. So it is from local language, colloquial language to the spoken language or spoken language of the medicines. That you have understood in your practice. So now you can never understand one language until you understand at least two. Now this is very beautiful quotations from Geoffrey Willemans. That the important task of translator. I can tell you that when I was started learning in the school age, we were used to speak in Hindi, and then gradually we entered into the class, and from the first day we are asked to understand what is the alphabets of the English. So we had the two language, Hindi and the English. Now and we were used to translate the Hindi into the English or English into the Hindi, and then we get a better meaning. Because when you are confident with one language, so you don't make any investigations. You don't try to think over it. But when you have to using it in the two language, you have to think about the words that you are using, and with this thinking process, your understanding will develop. So it is a better, useful, very much important for us to have the importance of the translation in our life. Friends, now what is translation? Now let us see what is the meaning of translation. Translation is the communications of meaning from one language, that is the source language, to the other language, that is the target language. One language the patient is talking, and that language is the source language, and that language that we are going to use it, that is called the target language, and it is the mathematical language, our repertory language. So mathematical language is also quite different, and repertory language is also quite different. So we have the barrier of the three language, the target language, the source language, and the two targets. One target is the mathematica, and other target is the repertory. So this is the important thing, and it is a communication. It means from one place to the another place. This is communication pattern that is very important to understand. And purpose of the translation. What is the purpose? The purpose of translation is to convey the original tone. Mind it, tone. Word tone is very important. How we speak and intent of the message. What is the content? What is the message and how it is spoken? Taken into account cultural and religion difference between the source and the target language. You get the point that tone, how the patient is talking, what is the content, and then in which culture it belongs to and which region it belongs to. So four area is there. The four things are there during the translation. That the tone, the intent of the message, and then the cultural and the religious difference. Among the same culture, you may have the two religions. Among the same religion, you may have the two cultures. So these are the four areas that the translation is important. Translation has been used by humans for centuries, beginning after the appearance of the written language, literature. The beginning of the civilization, human beings have been trying to translate the things that to make the understand what he observed from the nature, from the animals, and from the plants. That was the language of the plants from the animals, and that language was tried by the human beings to be translated into their own concept, and then tried to ascribe it on the literature. So this is the ongoing task with the development of the civilization, and we must, as a physicians, at this stage, we must be acquainted, we must be well versed with this aspect of the translation, because until you have a better understanding about the translations, you may not get into the right, because most of the time we are perceived by our own perceptions, and we try to apply our mind. Don't try to apply your mind, just try to apply, see what is the things there, and then and never use your mind. I say never use your mind, because if you apply your mind, you will try to prove it why you are right. And I may not always be right. I may not be always right. This is true. Because many a time what is there in the mind is not what is there outside. So be open while you are translating to be free from your own mind in number. And that's why Dr. Henneman warned you not to have a prejudiced objective. Friends, translation is not a matter of words only. It is beyond words. And it is a matter of making intelligible a whole culture. I remember I went to Nepal and at the place, the remote villages and medical camps we organized there. The greatest barrier for introgrators was the language. I was speaking only Hindi and English. And the local people, the patients who used to come, they were speaking and they don't know the Hindi or the English. So it is not the matter. It was the cultural thing. So we had one interpreter in between us who knew the Hindi language and English language and who knew the Nepali language. So with the first few patients were the most difficult patients. But when we started into the several patients, we tried to understand the tone of and with the tone we catch the words, and with the words we got the sentence and the meaning of it. So we have to experience how the patient is talking. He is talking about the pain, the word pain that was used by the patients and that you have in the mind, and that how it is expressed. This gives you the sensation and the modality at the same time. So this is translation is not a matter of the only words. It matters intelligible and a whole culture. And interpretation and translation, the two things are there. Language interpretations and translations are becoming increasingly critical part of practicing medicine. Now, we have the interpreter. There are the theme developing in medical science that there should be the interpretation, the language expert, and source of language has to be communicated in the most accurate way. And interpretation is applied aspect, what we perceive in our perspective. Friends, the scope of language challenges. What are the challenges? Providing a free flow of accurate information and clear understanding of the patient's problem. Free flow. Information coming not in a hesitation. When the patient hesitate or you hesitate, there is a breakdown. With the fear, anticipations, anxiety, there is a breakdown also. So free flowing information is required, and that only constitutes your proper understanding. The core principles underlie all communications. Human communicate symbolically. Even the language people speak, write, or sign are their essence symbol. The way you sign, every people are signing in their own way, and that becomes the symbol, the essence. And we have the language signature experts, and they can tell you what type of the person it is, what type of the person. So with this, and when you listen to the patient, you can understand what type of the patient it is. So listening and observing, it has to go side by side, and this is very important task for us. An issue of language assess and effective communication requires much more attention than what occurs when people start when they need. The need is different and attention is different. If you attend, you can perceive the need. You can get, because until you perceive the cause, you may not be able to assess the need. So need has to be kept aside. What the patient wants, they want to be cured. They want to be free from the problem. This is not the problem for you. It is the problem for you to know how this need can be solved. How this need can be solved. This is important. Keep in mind that how the problem has to be solved. So your attention is to be drawn where the people to find out how the problem, how the need is. It is not that you have. If you keep the what is the problem? The problem, if you think of only concentrate on the problem, you may not be able to understand the problem. Patients are always in distress. They never talk with a free mind. They over every time they talk with the prejudiced mind. And you don't have to be prejudiced like that. Their language is varied and most of their persuading in nature. Doctor Sahab, please help me, please help me. This is the persuading. I'm suffering from pain, such and law. You are like a god. He will try to influence you in different language. Patient language are overwhelmed by the emotions. This emotional language is very dangerous language. They act overwhelming with the emotions. Sometimes they will narrate wittingly, sometimes they will narrate angrily, sometimes they will narrate in a fearful way. So these are the different things. And our need is to get the essence of the problem. Number of languages spoken. Now, how many languages? Navigating into the barrier of languages spoken in different regions are quite challenging. We as physicians cannot be the master of all. Verbal language needs correlated with the body language to perceive the meaning and getting clarified is necessary. The only limitations for us that we have the two languages here, the verbal languages and the body languages, and beside that there are the regional and the cultural languages and interpretations. Now, taking the meaning of that, the first it involves rendering the live utterance in one language to live utterance in the another language. The source language is the language of the speaker or the singer. The target language is the language of the receiver or the interpreter. And interpreting necessarily involves one of the three possible types: a spoken source language and a spoken target language, a spoken source language and signed target language, and signed source language and signed target language. So these interpretations, these aspects will help you in arriving at the right interpretations, that means coming at the right meaning of the things. And interpretations, secondly, is the live act necessarily involves an immediate not characteristics of the translation. It is what the patient is live with you, he is seated before you, and immediately you have to translate it. You have to get into it. And that is the interpreter has to process the piece of his speech and render it either simultaneously and consecutively into the another language without the opportunity to consider the alternative. Suppose you stop thinking, what I should do, what I should do, and whenever these questions come, you will miss many of the aspects of the language. And simultaneous interpretations is very important. The patient speaks in their source language and the interpreters speaks in aloud. What is being said in the target language for the health provider. An interpreter is the same time comprehending the next part of the source language. So it is the source language and interpreter. You have to, and in the clinic, where is the interpreter? Who is the interpreter? You yourself is the interpreter. There is no one else seated there to interpret. Yes, only after conclusion of the session of the case taking, you may have some support from the guardians or the attendants of the patient. But between the patient and the doctor, the interpreter is only the physician himself or the person who is taking the history. So consecutive interpretation in an alternative form of interpretation called consecutive interpretation. The sender produces a short utterance, perhaps a sign or two, and then pauses while the interpreter renders these pieces into the target language. And upon completion of the interpretation, the sender produces the next short piece of the language. And translation involves movement between the written form of the two languages. Now we are translating. What we are doing, not only listening, not only you are looking, you are also writing down, or you are collecting on your video or on your audio recording system. But these video recording system, audio recording system, or writing system, you have to maintain a simultaneous involvement. It is important to acknowledge that there exists translation of unwritten language. Now there are some written some language that you cannot write, can you describe, and for that you have to use your wits. There are also translations between different sign language. Sometimes misunderstood, it is important to note the sign language is not universal. Now, sometimes the patient will give you the signal, and you may have the mind, but their meaning and our meaning may be the different. It is not universal. It is not everywhere the same thing. And essential characteristics of the translation, it tends not to be live. It involves longer time spans between the source productions and rendering into the target language. The time difference provides the opportunity for consideration of alternative translation, and translation differs from interpretation not because it produces different materials, but because it offers the opportunity to consider the input and the output. And skilled interpreters are key to the effective healthcare. Now, you have to be skilled, and gradually you can learn, or you can first be the observer, first be the listener, and you have the best way of learning is to observe and listen. So interpretations may fall at explanations involving bodily functions or critical injury due to cultural belief or an age differences between younger family members and an elder. It might be considered disrespectful for the younger person to present many types of the questions to an elder. This is especially true when dealing with a personal or sensitive topic. Now, the patients are coming in the right age group. You have the children before you have the old persons before you have the young persons, you have the ladies, you have the male, and same. If you ask them in a same way, the same way, they will be in the awkward positions, and many things remain hidden, and it will not be exposed to you. So you have to be gestures and miscommunications. Gestures and miscommunications of hands, arms, and head, and other parts of the body that convey meaning and or serious interactive functions is important. Research has focused on spontaneous gestures that co-occur with speech are beneath the level of the conscious thought. It is very important. When we are talking, how much you are using your body, or you are not using your body. When you are using your co-occurrences, if they go side by side, it can be the very useful information for you. So, spontaneous gestures do not have a prescribed, predictable form, yet they reveal aspects of thoughts that are not verbalized. Equally, common gestures include head nods in many cultures. And during the patient encounters clinical setting, focus on the patient. Now, what we have to do? Focus on the patient. Looking the patient in the eye will help in judging their level of understanding. Directly look into their eye, and you can have some guidelines for some perception about their level of understanding. Ensure that you are talking to the individual, not the interpreters or the family. Now, when you are talking to the patient, don't keep your mind here and there. You just need to have the face-to-face presentation. They will help ensure that the patient makes their own decision in an encounter. And during the patient encounter, clinical setting is very important. Will embarrassment about the topics, cultural age, or presence of family members in the room keep patient from telling me the truth. Just remember, so some questions may not you will get when talking about the person, and because patients may feel awkward telling their symptoms before the family members, and self embarrassment about the topics. You also have become you also become embarrassed when you ask the female questions, uh, being a male person, and at that time your self embarrassment is also a barrier, great barrier. So don't be embarrassed. You have to be open. You have to be, because it is the tools. It is the you are working there like a machine. But if you apply if you have your embarrassment emotions there it will affect the meaning of the patients. And what are the errors that may happen? The level of accuracy play a significant role in medical translation as human beings are involved. When translating, one has to deal with the abbreviations, which is where a few problems arise. Now, translations, we don't write the full sentence, we use the abbreviations. Often there are several abbreviations for the same terminology, and this means translation would reflect actual meaning. So be careful when you are using the abbreviated language writing for the. Now, creating option to address the language translation. Understanding from relative matters, words needs to be taken as root and sentence as expression. Relating both helps arrive at the right meaning. Friends, be willing to be a beginner every single morning. If you feel that you have become expert, you get lost. So always remain a child. A child within a man learns better than being an older or better person. So read these things and be patient with the patient who are not impatient. Be patient. We have to maintain with the patient who are not impatient. This is important things that we have to keep in the mind. And with this, I thank you very much for listening me, and I hope that you may have get some hints for the translation of the subtopic, and I hope you will be able to apply in your practice. Try to read, listen this video again and again so that you can get a very better meaning for that. And if you have any questions, you can write me at my email ID risats@gmail.com, or you can make a telegram message or WhatsApp message on 9431020622. So thank you, and with this I stop this sharing presentations. So friends, now the session is over. I hope you might have collected something and you got some information, and there may be many more messages from you. Next Sunday we will be coming again with another session related to the repertory and repertory mathematica rubrics only. So be with us every Sunday or at 11 a.m. so that we can get many more live presentations for you. So thank you, and with this I close the session. So goodbye, and we meet again on Sunday.